Hi, this is Dr. Daria Hamrah, facial cosmetic surgeon, Washington, D.C. And today we're going to talk about facial implants. Now, interestingly, most people don't know what facial implants are, or is this like rare thing. And the reason for that is that there's not many surgeons that actually are trained and versed in facial implants. It's a very niche procedure that only highly specialized surgeons that are familiar with the facial skeleton perform. I'm a double board certified maxillofacial and facial cosmetic surgeon. So my training started with the facial bones, with reconstruction of the facial bones and repositioning of the facial bones, and then later on the cosmetic surgery of the soft tissue aspect of the face, treating facial aging for cosmetic purposes. So because of my dual training and in-depth understanding of facial anatomy, I always try to address the face to where it's needed and what works best, and to kind of use different techniques and different technologies to combine them together to yield the best and most natural result. And that's key. There is not one single technique that can do it all. It's usually a combination of multiple things based on what the anatomy and what the aging process, what challenges it presents to us, and what kind of solutions we come up with. So I want to talk about how facial implants can be a great adnex procedure or isolated procedure, meaning you can just do, for example, advance your chin using a chin implant. If you have a weak chin, for example, which is just an isolated procedure, or you can do it in combination with a lot of things. For example, let's say you have a weak chin and you have a double chin as a result, so you do some liposuction, some neck tightening, which I talked about in a different video, or which I talked about previously. You can do some jawline contouring and liposuction, and then also give a little bit more projection and contour of the weak chin to make the jawline better looking, of course, in harmony with all your other facial features. For example, you don't want the chin to stick out too much, or vice versa, to be like too far up or too far down. It has to fit within your whole face. So chin implants can be a good adnex procedure, combination procedure to just harmonize and balance the face to where it actually looks good. Okay, so what are these implants made out of? This, for example, this is a chin implant here. It's made out of silicone, just like breast implants. It's actually solid silicone, so there's no fluid in it. It's very smooth. There's other implants, older implants that are roughened surface like Medpor. We don't use those anymore. They tend to get infected, and they're very hard to remove. The beauty about these implants are that you can remove them or you can replace them at any time in your life. Just last week, I removed 2 implants of someone that had them done I think 15 years ago. 2 patients, one had them 10 years ago, one had them 15 years ago. And the reason why they asked me to remove it, because they actually didn't need it. And the doctor basically misdiagnosed their facial profile and their facial structures and gave them a chin implant that they actually didn't need, and it made them look weird. And one of them actually was placed crooked. So it's, again, very important that you go to an experienced surgeon, because in the first case, the diagnosis was wrong. In the second case, the execution was wrong. In the first case, patient had a chin implant that didn't need it. In the second case, patient had a chin implant that needed it, but it was not placed correctly. So again, these are made out of silicone, and silicone has been used in medicine for a century now. It's completely biocompatible, meaning your body doesn't know it's there, okay? It can't recognize it as a foreign object. I think in the United States, about 80% of women above the age of 18 have breast implants. That's actually a current statistic. So, and if there was a problem, we would hear about it. And these can be placed through inside the mouth, which I mostly like to do, just because I don't want to give someone a scar, or through underneath the chin, make an incision here through the skin. They can be placed on a chin. And they're really placed here. So if you look at the skull model, they're actually placed onto the bone. okay? They're placed on the bone, and what I do to prevent movement, I actually secure it with a tiny mini screw so it doesn't move around and it stays there even in 30 years from now. And at any time, it can be removed, okay? And there's actually, I don't know if you see it, there's a blue line, which is a midline indicator. So you just have to look. You have to look and center it within the middle of the jaw, and then that has to do with execution. And if you don't secure it, it could move, so therefore I secure it. Okay, so a chin implant can greatly enhance your jawline and can improve your profile if you have a weak chin, and kind of improve your neck to chin angle, and if you have a double chin, in combination with liposuction or neck tightening. Also, there are implants that are used to increase the volume of the cheeks, okay? So a lot of people are familiar with fillers, which is a injectable that you inject into the face to increase the volume. The problem with fillers is, as good as they are, a lot of times, they are injected in the soft tissues. And as we age, they actually move around, and they're supposed to dissolve. There are temporary, most of it dissolves, but some of it doesn't. And when you keep getting fillers injected over and over, and it kind of gets layered like a cake, at some point it starts distorting the face, especially with the movement of the face. When you smile, when you talk, so your face moves around, and then sometimes you can see the filler. It just kind of looks unnatural. So I'm not a big fan of filler, and I use it for the right indication, but I don't overuse it. And unfortunately, a lot of times fillers are overused just because, there are people out there that's all they do. That's their one hammer for every nail, and they try to rejuvenate everyone with filler, and a lot of times it's not a good idea. So what I love about cheek implants is if you have a cheekbone that is relatively flat or retruded, and that's based on your DNA, based on your anatomy, that cheek implant is placed actually onto the bone. So it's placed right over the bone here. So I'll show it on my face. And it's placed from inside the mouth, from inside the gums. It's placed here, for example, and it's also secured, and it doesn't go anywhere, and they're customized. So depending on where you want to have the augmentation, you choose a different shape implant that is made specifically to augment the desired area, as opposed to just putting something in there that might not make you look natural or good. So again, choosing the right implant has a lot to do with experience, know the signs, know the facial anatomy, have an artistic eye, know how you can balance the face and make it look natural, because if you don't do it right, it's not going to look natural. Just like if you get fillers injected into the wrong spot, it's going to make you look weird. So it's something that, again, it's a very specialized procedure. You won't see many people offering it to you because they're not familiar with it, but it's a great alternative. You can do it in combination with a facelift. And if someone has mid-face hollowness or deficiency, I love it much better than having fat injected. Fat injection is right now pretty hyped. You will probably get it offered with any procedures that you do. I don't like it because it's very unpredictable. This is very predictable. It doesn't change its form. It doesn't change its size. You place it exactly where you want it, and it doesn't go away. But if you want to, you can get rid of it. So there's nothing more versatile and practical than a facial implant. And again, the only reason why you don't hear much of it, because there's not many people knowing how to utilize them. Hope that video helped, and hope it broadened your perspective a little bit and your knowledge base. And don't forget to ask your doctor about this option. Thank you very much for listening. And this is Dr. Daria Hamrah, facial cosmetic surgeon, Washington, D.C.